We might start the next session. We know now from Tony that we're surrounded by bacteria and that they're everywhere. But having done a doctoral thesis in delivery of particles to the airways, I can assure you it's quite hard to get particles into the airways. And for that we use specialized delivery equipment like the nebulizers that you'll be familiar with. The last thing you want to do is actually use a nebulizer to deliver contaminated particles to the airways. So that's why I'm very glad that our senior respiratory physiotherapist, Krystal Williams, will now talk about how to keep devices clean. Thank you.
Thanks everyone. Thanks Andre. So hi everyone, I'm Krystal and I'm going to talk to you about the best ways to keep your physiotherapy devices infection free. So what I'm going to cover is I'm going to talk about common airway clearance equipment that we use in physiotherapy. I'm going to talk about the recommended cleaning guidelines, sterilization guidelines and how to store them, and also when you need to replace your equipment. And then I'm going to go through the same type of topics for all the inhaled therapy and equipment that we tend to use, and then we can time for questions at the end.
Are you giving a handout, Krystal? Sorry.
I'm not.
You're not. Okay.
So all these guidelines and recommendations are based on the consensus statement. So this is put together by all the physiotherapists in Australia, and we meet every 4 years and basically talk about physiotherapy in general and make a list of guidelines about what we think is best practice and what the latest research has shown, and put that together for people to follow. So it was last done in 2008, and we reviewed it at the recent CF conference in Auckland, so that newer version will be coming out quite soon. And these guidelines also reflect the Princess Margaret infection control guidelines as well. So some of the common airway clearance equipment we use in physio. So we've got PariPEPs, PEP masks, acapellas, bladders, and also bubble PEP. And these are the main ones that I'm going to talk about. All your airway clearance equipment should only really be used with the one patient. It shouldn't be changed between patients or between siblings. And one of the really important things is you need to know how to completely take your device apart so you can clean all the specific small areas, because that's where most of the moisture will be and that's the most potential risk in terms of cleaning. So this is PariPEP, so this is quite commonly used. This is the sort of older version of it. When I mean PEP, what I'm talking about is positive expiratory pressure. So it's a device that when you blow into it, you're blowing into a little bit of resistance. And what this does is it creates back pressure in the lungs. It helps to open up the airways and the alveoli, so you get better ventilation through the lungs and also better movement of sputum up the central airways and removal. So there's sort of 4 parts to your PariPEP. You've got your solid mouthpiece here, the lower part of the resistor, the upper part of the resistor, and this small valve. So when you clean your device, you actually need to take this small valve out. This is the area where a lot of people don't clean around as well, and you also have to be really careful because this is the bit that tends to get lost. By the time we actually, if you lose that little bit, by the time we order just this top part here, it costs mainly or nearly the amount of the whole thing. So just be really careful when you wash it to put it somewhere so that it doesn't get flushed down the drain with the water. The other problem we sometimes have with these is kids being kids tend to bite on the mouthpieces a lot, so we tend to get teeth marks and rough edges. So when this happens, you actually need to get a toothbrush or something similar to scrub in that area to make sure you're cleaning all that out and removing any potential risk of infection. This is a newer version of the PariPEP. Has anyone seen this or is using this? Yep. So this is the newer style by Pari. Again, it's just got a little bit of an extra part. So it's still got the solid mouthpiece, it's got the connector, and it's got this small part here. So in the previous PariPEP, there was an extra part that's not shown here, which is this with a small little connector, and you can usually just leave that and keep it apart, but for this it's in this device permanently, so it's important to clean around this little area. And again, what it's used for is so you can attach a pressure monitor, so you can look at the actual amount of positive pressure that you're getting when you're doing therapy, but usually when you use it, it should be closed. You've also got your resistance ring, and again, the little valve that you need to take off, and then just the other part of the end part of the device. So PET masks. So PET masks, there's lots of different varieties of the actual face mask. The older type is this clear version with this blue edging. You actually need to take the blue edging off to be able to clean it properly. So it actually unhooks from these small little clear parts here that you can see. And again, there's lots of different face shapes, and they're actually really hard to get on and off, so it just takes a bit of practice. One of the newer versions are these clear versions here, and it's the little baby one down here, and they're just a continuous piece of plastic, so it's a little bit easier to clean because you don't have those edges and those hidden parts. I guess one of the downfalls is that sometimes people say they're not as comfortable as the older type of the blue version of the mask. So there's pros and cons for both. When you look at your whole PEP setup, you've got your mask, you've got your valve system, and then you've got your set of resistors. So it's really important to take all the parts, all the bits and pieces apart, particularly taking the resistor out of the valve. This is the bit that tends to get stuck, and sometimes you need to get pliers to take it out if it's been stuck there. And because you can get moisture that's trapped in there, it's really important to take it out completely. Again, one of the other things we've just noticed is it's important that if you've got other family members that aren't as familiar with the device and you've taken it apart to clean, make sure they put the resistor back on the outside. So this is the inspiratory, or where the air goes in. This is expiratory, where the air goes out. So the valve is always without breath. Okay. A bladder, again, it's just another airway clearance device. This is probably one of the simpler ones to clean. It's really hardy, and you don't really get teeth marks in it as much as you do with any of the other peripeps. And it's just the four different parts that you can see there. And then a cappella, we don't tend to use these very much. Does anyone use this? No, okay. We don't tend to use them. One of the main reasons is they're a little bit difficult to clean because they have a metal magnet and a bit of metal through here, which makes it a bit harder to clean. So in general, there's lots of cleaning recommendations for the different products. Some products have 4 or 5 different ways you can clean them, but this is the way that's consistent for all the different products. So this is the way that the Physiotherapy Society in Australia recommends that you clean things. So you have to take everything apart completely, and they recommend that you clean it immediately after you use it. So if you use it twice a day, after the first time you can just either leave it on the bench to dry, or you can rinse it with water and leave it on the bench to dry. But every day, once a day, you have to make sure that you wash it properly. So washing it involves using like warm soapy water with a mild detergent, and that type of mild detergent is just like dishwashing detergent that you would have at home. So put it in a bucket, warm soapy water, wash it with warm detergent, and then rinse it off under the tap with warm water, and then leave it to dry. So you don't, when you rinse it, it's best to rinse it straight under the tap. If you washed it in the bowl, tip the water out, and then just put new water in the bowl, you've still got things in the bowl which might be contaminated. So it's best to take it out, run it under fresh water, and leave it to dry. We recommend that you leave it to dry on a lint-free towel, and you want to keep it away from moisture. So ideally, don't let it dry in the sink or in the bathroom or near the kitchen where you're doing food preparation. Good places are bookshelves, window sills, and something that's a bit higher away from pets and animals and kids.
I've got a quick question for
Yeah.
you. You said put it on a lid-free towel. Can you put it on like in how you've got like a cooling rack where you put your muffins, so it's not straight on a...
Yeah, look, that's fine. The main thing is just that it's standing in a good position so that it's actually going to drain, and that there's not going to be moisture that's sitting and sort of holding it. You sort of want the moisture to drain away, so that would be fine. Okay, so that was cleaning. So now we're moving on to sterilisation. So we recommend that you sterilise physiotherapy products 1 to 2 times a week. So if you used your physio device twice a day, every day of the week, then we recommend you do it closer to every day. What we recommend is that you boil it for a full 10 minutes sort of on your stove top, and you can use the baby bottled steam sterilisers. We don't recommend that you use any of the chemical products, and this is because if there's any sort of left on the device, it can be inhaled, and physio's sort of body thinks it's just better to use the sterilising on the stove top because there's no other added chemicals in that process. All the devices in the manufacturer booklets, it says it's okay to dishwash to clean them, to sterilise. We are a little bit careful in saying that is okay, simply because we can't tell that everyone's dishwasher at home is giving above 70 degrees for a constant 10 minutes. It might very well be doing that, but we can't say that it definitely is, so that's why we always encourage you to do sterilising on top of the stove so you can see exactly what's happening and know that it's a full 10 minutes boiled at 100 degrees.
Sorry, another quick question.
Yep.
You said you can use baby bottle sterilisers.
Mm-hmm.
Is that also the one that you can put in the microwave?
No, not that one. No, the other time. We can talk about microwaves in the end if you'd like. In terms of storage, so Tony also said one of the most important things is that your equipment is completely dry before you actually put it away to store it. This is because moisture obviously is a more ideal growth environment for a lot of the microbes. We recommend storing in either a clean plastic bag or a clean, like reusable, resealable bag or a plastic container. And you want to keep it away from direct sunlight, pets and moisture again, as we've been speaking about. It's good to label the containers, and again, keep your if you've got siblings with cystic fibrosis, keep everything separate. Okay, so when do you replace things? This is different depending on what device it is. It depends on how often you use it. So obviously, the more often you use it, the more likely you're going to need to replace it sooner. And also the way that you sterilise and clean and store your products. So most of the time what we're trying to say is that if it looks good, if it looks like it's fairly new, it's working well, then it's probably going to be okay. If it looks cracked, broken, dirty, discoloured, making funny sounds, doesn't seem to be doing the right thing, bring it in and we'll have a look at it and we can replace it for you. Okay? So if you want to get your equipment checked, whenever you've got a clinic appointment, just bring it in and we will have a look at it for you. Okay, so bubble pep is the other thing that a lot of people use from time to time. This is basically following the same principles, it's just slightly different in a few ways. So if you use it twice a day, you can rinse it after the first use and then just leave it air dry. But every day, once a day, you have to wash it in warm soapy water, as you would with all your other devices. Rinse it off and leave it to air dry. You want to try and ensure that the tubing is dry at the end of the day. So sometimes it's a little bit difficult, so you want to try and either hang it up by one end. Otherwise, you can use hairdryer or use the end of your nebulizer the same as you would for your nebulizer tubing. In terms of sterilising, these are a little bit harder to sterilise. So either we recommend that you throw them out after a week and get a new set. So again, it's just a 2-litre bottle of milk or orange juice, and the tubing you can generally buy at any of the Bunnings or the Clark rubber stores. Or otherwise, you can actually sterilise the tubing, but it does sort of disintegrate after a while, so you have to replace it more frequently than any of your other devices and equipment. And storage, again, it's quite big, but you want to try and store it in a dry place away from moisture. So now we're going to talk about common inhaled therapies. So I'm going to go through the Parineb pots, the masks, tubing, compressors, and some of the newer types of nebulizers which are around, which is the eFlow and the AeroNeb, and as well as spacer cleaning. So again, all the pots and tubing should really only be used for the one patient, and you need to know how to take it apart and put it all together completely. So this is the LC Sprint. So this is the most common type of nebulizer. So again, it's a breath-enhanced nebulizer. You get good deposition and you don't get very much wastage of the drug with this type of delivery system. It's quite straightforward. So you've just got obviously the nebulizer cup, the lid at the top, which is just a latch, so it's all attached to the insert, and then the mouthpiece, and the mouthpiece has got the expiratory valve or flap. It doesn't completely come off, but you should actually unlatch it on this side so you can clean under in this bit properly. slightly older version of the same nebulizer, so this is what's called the LC+. Some people might still be using these, so the Sprint we commonly use for any pulmozyme, any antibiotics, or sometimes just hypertonic by itself. This is the older version that we tend to use when we combine hypertonic and PET together. So again, it's got the body, the insert, it's got the inspiratory lid, the lid plus the little valve. So again, take the valve off to clean it and lift the little flap on the mouthpiece. So a lot of the kids do the combined therapy where they do the hypertonic and the paripet. So again, this is the older style paripet and this is the older style nebulizer. What you do is you take off the mouthpiece with the expiratory valve, put on the solid mouthpiece, and then take the cap off and then just add this section on the top. You end up with this. And again, you can clean it all together in the same way as we go through again afterwards. This is the newer version, so again, a new PEP, the Sprint, and basically just take the end off, take the mouthpiece off, and it slots on together quite easily. So mask for nebulizer, so if you've got young children with CF, they always will start off with the mask generally. So this is the baby mask with the baby vent, so that's the little expiratory valve. When the kids get a little bit older and they've got a slightly bigger face, this is the fish mask. It's important to clean around this little expiratory flap properly and make sure that it stays on the outside of the mask when you finish, so that when they breathe out, the flap will open and the air can come out. We always try and progress children onto mouthpieces as soon as possible, because mouthpieces you get a better deposition of the drug down into the lungs. So who actually uses one of the mesh nebulizers? Couple. Yep. Okay. So these are sort of becoming more common. eFlow is probably one of the first ones that was developed. It's much faster, so it cuts down your treatment time by about 50%. So pulmozyme would take 2 to 3 minutes, tobramycin would take 6 to 8 minutes. The problem is though, even though it's nice and portable and quiet, the cleaning actually takes a little bit longer, so you can actually see how many pieces are involved. So there's a mouthpiece with the expiratory valve, the chamber, the valve, the actual aerosol head with mesh that requires an extra step in cleaning. Again, the reservoir, the cap and the seal. So all that needs to be washed together, so that adds a bit of time onto your treatment. So as I said, the actual mesh of the eFlow needs additional cleaning because it's very, very fine and it can get clogged quite easily. In the newer eFlow packages, when you buy them, you do get this special mesh cleaning device as well. So they say that if it's taking more than 4 minutes for 2.5 mils of normal saline to run through your nebulizer, you need to use this special mesh cleaning. You shouldn't use it more than 2 times a week, and once you've used it 25 times on the one aerosol head, the aerosol head goes in the bin and you need to buy a new one. They don't recommend that you do it after every treatment because it will wear down the mesh and you'll get a faster deterioration of the actual mesh head. Okay, and you need to do this specialised cleaning on top of all your other cleaning as well. The AeroNeb Go, this one is become a little bit more common recently. I think CFWA has purchased some of these and they have some eFlows which they give to people when they're on lots of inhaled medication. So again, it's portable, it's quiet. This takes a bit longer, so it takes about 7.5 minutes for a usual dose of medication, but this costs about $500 compared to about $1,500 for the eFlow. Basically, this has mesh in it inside here. You can't clean the mesh specifically, so once it takes more than 12 minutes to do a neb, this whole thing goes in the bin and you have to buy a new unit. So in terms of cleaning neb pots, it's very similar to all the devices. The extra things are you just empty out the medication. You completely take it apart, which is the same step. For the mesh devices, we recommend you clean them basically straight away after you've done your therapy. Some of the medication you might nebulize is very thick and the mesh is really tiny, so it's easy to clog, so it's better to clean it straight away. All the pari-neb pots, they can be cleaned at the end of the day. So for example, if you do tobramycin in the morning, take it with your neb pot. When you finish, empty out the rest of the solution, put it in a bowl by the sink, leave it, and then at the end of the day, you do your pulmozyme in a separate neb pot, take it apart, put it in the bowl, wash them all together at the end of the day, that's okay. So after each use, we recommend washing in warm soapy water. Mild detergent again, same as dishwashing detergent. Rinse it off straight under the tap with warm water and air dry on a lint-free towel. So again, this just pictures, so look, you can wash it in your sink, but after hearing Tony's talk about how clean things are, you might want to rethink that and maybe just have it in a container. It's a bit easier to wash, and the container can be a little bit easier to clean sometimes. So wash it around in warm soapy water, give it a good wash, scrub it if there's any rough edges, rinse it straight off under the tap, and then leave it on a towel where it can drain properly to let it dry. So cleaning for nebulizers and for the actual tubing and the compressors. So if there's any moisture in the tubing when you finish your nebulizer, you should take the pot off and leave the tube connected to the nebulizer. Just turn it on and let it run. The air coming from the nebulizer will automatically dry the tubing. In terms of the compressor, every year it should be, you should bring it in at your time of your child's annual review, and they will change the filter, check that it's working properly, and look after it. It's also a good idea just to wipe your compressor from time to time with antibacterial wipes if your child, particularly if your child's unwell and they've been touching it, they come home from the hospital, they're well, you don't want them touching it all over again. Sterilising, so it's the same as for all your other devices. Again, if you use it every day, twice a day, we recommend once a week. Boil it for a full 10 minutes, and everything else is the same as it was for all the other devices. Storage, so make sure it's completely dry, particularly if you're going to be storing it long term. So if you have a child that uses a Sprint for nebulized medication, for antibiotics, and they only use it when they get unwell, so you put it away for 6 months, sterilise it before it goes away, and when you pull it out, it's probably best to sterilise it again just to make sure that there's absolutely nothing that's growing on the equipment over that 6-month period. Again, everything is the same. You want to make sure you label your neb pots, because obviously some medications can't be mixed and put in other neb pots. And the actual compressor, you want to keep it out of direct sun but in a dry, cool area. When to replace, again, it depends how often you use it, what you're actually nebulizing and how you're cleaning it and storing it and sterilising it. If it looks cracked, dirty, looks ugly, then bring it to clinic and either the CF nurse or one of the physios can replace it for you. For the peri-neb pots, if they're used twice a day, usually they should be replaced every 6 months or so. If you're using it less frequently, it could extend a bit longer than that. And each time you get a peri-neb pot, you'll automatically get the tubing to replace it as well. So spacers are the small exception for the cleaning, so it's just slightly different. So when you take a spacer out, so you should always use a spacer when you obviously have any metered dose inhalers or puffers. When you take it out of the box, you want to clean it before you first use it. To clean it, take it apart, put it in warm soapy water as you usually would, and then just leave it to dry. So we don't want to rinse or dry it with any sort of cloth, and the reason is that the spacers have static inside them, and static causes the particles that you're spraying into the spacer to stick to the spacer. And by leaving that little layer of soap on the inside, it will make sure that the particles don't stick to the spacer, they'll be sort of propelled and they'll go straight through to your child's lungs rather than stick to the actual spacer. So just leave the soap on and let it dry. So in summary, we know that cleaning, sterilising and storage is important to help minimise infection and bacterial growth. Cleaning and sterilising and storage should be part of your everyday airway clearance and your inhalation therapy routine. It's just as important as actually doing the physio or doing the medication. It's also cleaning it to make sure that you're not that you're keeping everything in a healthy way. In general, for cleaning, we recommend that you clean every device, nebulizer, everything, once a day, warm soapy water, rinse it, let it dry on a lint-free towel. Sterilise every 1 to 2 weeks by boiling on the stove for 10 minutes, and make sure you don't store it until it's completely dry. If you have any questions or concerns, come and speak to your clinic physio or one of the nurses anytime you come into Princess Margaret. Questions?
If you, me often, forget to wash your neb off and you quickly run away,
Yes.
and then you come back to do your next one and it's dirty, so you quickly wash it.
Yes.
Can you use it once it's washed, even though it's not dry?
Ideally, you would like it to be dry, but if it means that, if it's between not taking your medication because it's wet or taking your medication and just trying to dry it as best you can, it's better to dry it as best you can and take your medication.
Could you hair dryer it?
You could hair dry it, yes, that's fine.
I asked a question about the pet mask that Tia uses, the valves in it. I'm usually like, I'm hoping they're dry because you can't take that apart. So yeah, we get the hair dryer and
Dry it.
yeah.
So we're talking about, hold on.
Yeah.
We're talking about this resistor. So it's obviously a three-way resistor. It's actually really hard to get dry because there's lots of different intricate bits in there and you can't actually pull it apart anymore. So when you dry it, it's important that you change sort of the position of it. So try and put it in a position where it drains the most, but you might also just need to flip it out and change the position sort of halfway through the day to make sure it's all drained.
And with boiling water, you obviously boil water up and then throw, because I don't do that, nor do that. Do I throw that in after obviously it's at a boiling point, or do you put it in like your tap water and boil it in it? Like what's, because mine cracked once, I'm not sure why. I got a crack in it and I was wondering.
Look, it doesn't matter if you put the devices in first and then bring the water to the boil. The most important thing is that once it's boiling, it stays in there for 10 minutes. So either boil it and put it in for 10 minutes or bring it to boil and then start timing for 10 minutes. In terms of the pet mask cracking, because there's so many different masks, some of them actually do crack, and I have had them crack or melt, and sometimes it just is the mask and sometimes it's just the fact that it's being used a lot, which is good, and we might just need to replace it at that point. Yes?
Two things. One is the little valves used in the pet things, the little blue valves. Yeah, they tear really easily.
Yeah.
Is it possible to get replacements of just the valves?
You can't get just the valve, you can get this end unit, but again, it's actually quite expensive. It is a big problem because it is a small hole and it does fit on quite tightly, and then when you keep pulling it off and pulling it on, it wears it quite quickly.
Because to be honest, I used to do that. I was pulling it off and on all the time, and then when my daughter was in hospital, the physio who was doing it never take it off, never took it off when they cleaned it. So I stopped because I thought you didn't have to. So I'm now going to have to start doing it again.
We do recommend that you take it off. It does wear and tear your product a bit more, but we would rather you clean it properly and use it more regularly and us replace it than not have it cleaned and have that potential risk.
Can you just pull the flat back and then clean it so you don't have to literally pull it out? You just pull it to the side, clean it to the side, pull it like 4 times?
Look, if you're going to sit there with it in the tub and make sure you clean under all the edges, you're still not going to be able to get around that centre edge very well. So it's better to take the whole thing off and clean it.
What if you let it sit there and soak for 5 minutes so it just goes?
Well, I guess you're hoping that by soaking it's going to get every single bit, but then again, unless you completely take it off, that you don't know that whole surface is being in contact with the soapy water. So I would recommend that you take it all apart. Yes?
Sorry, the other one I had was the steriliser, like the baby bottle steriliser.
Yes.
You go into a baby shop and there's like a million of them and they all have different, and eventually you can find out the sterilising comes, because when I was looking up the Harry stuff, it recommends 15-minute minimum of 15-minute sterilisation time. It's not a single baby bottle steriliser on the market in Australia that sterilises for 15 minutes. I found one that does 13 and I've gone with it.
The Parry, they do recommend 15 minutes, and a lot of that is because sometimes we'll put the stuff in the water, and so by the time it boils it's 5 minutes and then it's 10 minutes of full sterilisation, like at 100 degrees.
Okay, because there's quite a few of the brands are only do about 6 minutes, and that's probably the most popular brands are 6 minutes.
Yes.
And that's why they said not to do the microwave ones, because they're only 5 minutes as well.
Yes.
When you use the old LC, combining hypertonic saline with Harry, is it they're not making those anymore?
Yes, it is. So they've stopped making this nebulizer. We have asked for all the stock in Australia to be delivered to us because we know how much everybody loves this and loves this, and people aren't as happy with this. It's a bit fiddly, it looks funny, no one wants the cat, kids play with it, it breaks off, you don't get your pressure, you can't use it properly. But again, Harry have said they're going to keep making this, but they're not going to make this actual neb pot. So, I don't know. But we've said that we much prefer the older version. They like this neb pot because this is the upgraded version, so it's a slightly better deposition, slightly faster, more effective than the previous version, but they just decided not to make it. They're basically moving everyone onto this. So that's what you will see more of.
But with that one, you can rip off the lid and shut the tip on the top.
Correct. Yes. So there is a naughty way that you can, I say that because you're not supposed to do it, but there's a way that you can add this to this by ripping off the lid, breaking off a bit of plastic, but then the nebulizer can't be used for anything else. So if you come across that problem with PMH, I'll show you, but I'm not going to show you.
Wouldn't that be a good thing though, because then you know that one's solely for saline and not for your other. So instead of writing on Clifton neb or
Yes.
Togromycin neb, you know that one is solely your saline neb.
Yes, you will definitely know that. At the same time, you know, writing on it, you'll also know.
The writing comes off.
The writing does come off, I know. Yes, permanent marker, and you just have to redo it and redo it and redo it, and you have to label every bit of the pot as well. It's annoying.
So how often do you have to change the tubing that connects from the nebulizer to the pot?
Basically, every time you get a new nebulizer, you should change the tubing. Harry sort of recommends that you don't actually boil the tubing. I boiled it myself and it was fine. What do you think, Ali?
I've boiled it many times.
Yeah, I've boiled it and it's been fine. I don't know why they say that, but it's fine to boil. I don't know if it'll disintegrate after 3 months rather than 6 months, but you can boil it and it's safe and it will make sure that it's sterilised properly. And you would do that with your neb pot, all in the one pot on the stove.
So how often would you boil it then?
I would boil it when I do my nebulizer.
The tube?
Yeah. I think if you're going to do the nebulizer, why don't you just do the tubing at the same time? At least you know that it's clean.
What about the blue machine that nebulizer goes to?
Yeah.
It has that black filter, do blacky sticky outy thing.
Yeah, the little, there's a little, yes.
Do you boil that as well, or?
I don't see, I must say I haven't actually tried to boil it. I don't see any reason why you couldn't boil it. I'm not sure. I think you could boil it. Okay. All right. That's my favourite slide.
Our next speaker needs no introduction to you. Ms. Boulding is a clinical nurse consultant at Respiratory Medicine at BMH. Now, Leslie is very well read in the literature, but on top of that, there's few people in Australia with the same amount of experience in dealing with CN, and Leslie also brings to that a beautiful pragmatic approach. So.
Thanks, Andre, and thank you very much for having me. Just a commercial, well, I should have done this before, shouldn't I? But I had a coffee. Just commercial about your nebulizers. Those neb pots cost us $50, the hospital, $50 each. Pari Peps are $2.50. If you lived in South Australia, you would be buying them all yourself. They don't service their nebs over there. So I think we're pretty lucky, and I kept really quiet after I heard that. I think, oh my God. So, pretty scary stuff. Yep.
Double click.
Cool. Nearly there. Where is it?
On the top.
Oh, thank you. Be useful if I got to the right place, wouldn't it? And where's the... Here.
Right on top there.
Okay.
Yeah.
Yeah. Bingo. Oh God, that doesn't come out very well at all. I'm really sorry about that, guys. Just before I start, when Catherine asked me to speak at this seminar, I thought, oh yeah, this is really interesting, seminar. Cruising. Then I looked at my topic and I thought, I'm talking to the best managers in the business, you guys. So what am I going to talk with you about? So I thought I'd concentrate on balance and focus. Now, most of this is my thoughts, the part of the thoughts are mostly too, but I think they underpin the philosophy of our multidiscipline at P&H, and I'm sure Rhonda will keep me on track if I don't. So, away we go. Okay, so, bugs. Well, Tony's given us a wonderful insight into bugs, and I don't think I really need to say any more. We've had our lovely cleaning lady here as well, and she's done an awesome job. So that comes down to me in about living life, and I've lived a couple of months, and it's really important that we enjoy our lives. And so, I'm always about talking quality of life for you, your children, and your families. I'm telling you, that at the diagnosis time, there's always a lifestyle change. Where does CF fit into your life? It's a huge question, and I'm sure you can tell me how you've struggled with that. But it's about lifestyle and balance, as always. Cross-infection, we know, is a huge issue for you. That's why you're here today, and that's why we got the best in the business, Tony, to speak with you. And as Tony and Andre have alluded to, when we've got difficult bugs, it's phone Tony. He'll sort it out for us. So yeah, it's really important, as I said, quality of life and quality for both the child and the family. And fear can be a really crippling thing. Fight and flight are useful things, but fear needs to be managed. And I think it's really important that we always remember that these are people. Children of people who have cystic fibrosis, the most important underpinning there is. So, I thought I'd be talking to an audience with mostly kids, and I can see some of you have got bigger kids, and I know the ages of your kids. But anyhow, I think most of this is still, fairly appropriate. So what's important to being a kid stroke a young person with cystic fibrosis? They're basic things, but they're really important. I don't think it hurts us to have a little look at this stuff. And this is what's good when people like me are preparing talks like this. It takes us back to the literature and we think, yeah, forgotten a bit about that. So, as I said, this is about focus and balance. So, eating healthy, age-appropriate food. We could all do with a little less of the good stuff, but there you go. It's all about balance once again. Sleep, really important. Quality of sleep, how we get our kids to sleep, how we start tuning them down, ready for sleep, really important. Shelter is a very basic need, and when I talk about shelter, I'm talking about a home. Most of us, well, everybody in this room has got a lovely home to go to, and their kids are well cared for and accommodated. Kids need adult caregivers to protect them from danger, and I'm talking about all sorts of dangers in the real broad context. Kids should be free from abuse and or stroke neglect, and that's not always the case, and particularly in P&H we see a wide variety of this. Unconditional love. What's unconditional love? Interesting, isn't it? And we think we all do this so well, but I'm a dog lover. I just go to my dogs and I look at my dog at night, and I just see that look on their face and I think, okay, there's some well-work this. But it's important that you have a loving relationship with your kids. The kids will have not so loving relationship with their siblings at times, but that's what being a sib's all about, and it's part of life as well. Important that your kids have room to explore and play. Get out in the park. You know, when I was younger, the kids of Perth all used to play at their front yards, and I know things have changed and it's not as safe. But, you know, it's a really good excuse for you guys to get out to the park and get down and dirty and kick a footy, etc. with your kids. And the nice weather's coming, so it's just gorgeous out there. And you get some vitamin D, and you might have to take pills. Great. Not too much pills. Interaction with their peers. It's important kids have friends. Really important. Respect. Interesting. Respect is earned, but it's a two-way thing. Positive discipline. Okie dokie. Did you see the sunrise this morning? Kid got kicked off a bus in Sydney because it was being too noisy. Really interesting. Mind you, the downside of that was that the bus driver did a dummy spit and sat in the bus stop while the mother settled the kid down. Who's the adult here? Okie dokie. Learning life skills, kids, that's what being a parent is about. It's about sharing our experiences and allowing them to learn. Freedom and encouragement to reach their potential. Very important. Very important. So, how do kids reach their potential? Kids with CF can do anything, you know. We've got a huge variety of people with cystic fibrosis. We've got national sports level people. Some of you will know of the Western Force guy. I don't know whether he's still around. I'm not a rugby person. But, I mean, he was playing, national level sport with CF. Takes a lot of work and a lot of discipline. We've got academics. We've got a PhD doctor who actually works with our CF program. And it's, that's a wonderful achievement. We've got teachers, IT workers, people working in the health industry. We've got receptionists. We've got the gambit. Everything. So, whoops, move on. Some of you will have seen this and some of you won't, and I found it quite interesting. Probably most of us have heard of Maslow, who was a great psychologist in the early 40s, even longer ago than I've been around. And somebody else has come up and built on his work and put up a hierarchy of needs for kids. And it's the stuff that I've been talking about. But I think it's it's really interesting to see it in a table form. What is important to kids? They don't really need much, do they? They don't really like much. And that's apart from the iPads and God knows what else. But as all parents, we dream. We dream for our kids. And I hope you dare to dream. It's really important. Okay, so it's important to get the balance right. Being a kid and managing CF, how do they do that? And being a parent and managing your child's CF and working with your child. Guys, if you're struggling and it's a challenge, we can work with you with that one. So do seek help and seek help early. It's not an expression of your failure. It's more of an expression that you recognise that it's tough. School. Oh my goodness. Achieving at school is really important, and minimising sick days where possible. Schools often ring us and say that they haven't seen kids for quite some time. It's really important that they do school. And in this morning's paper, I see a quote from Jonathan Karapitis, who is our telethon professor, director of telethon, and he says, and I quote, "There is no safe level of absence from school." And I thought, I like that, that's really good. So if your kids are sick, and we all know about kids that have a tummy ache and try it on us and they go to school, they stay there all day beautifully and it's not a problem. And I know you have problems with your kids who might have a cold and things like that. But it's about balance. Schooling is really important. achieving is really good for the soul. You know yourself when you do something well, you think, yes, good. And it's normal for kids to go to school. That's it. Kids go to school, and we all loved it, hated it, etc., but it's really an important part of life. It's part of socialisation. That's how we learn to take, roll with the blows. I got teased horribly as a kid. Oh my God, mercilessly, and I've survived. Most of our kids have survived. And I'll tell you what, schools have got much better things in place for looking after people that are being teased. Friends are just the essence of life. Anyone that's got really good friends just knows how important that is. Sleepovers and hanging out, well, that's what kids do. And look, God forbid I say it with a couple of physios in the room. Look, if your kids need to sleep over and you miss the occasional physio, it's not going to be life-threatening. This is hanging out is really good stuff. And then you can go, get them home the next morning and give them hell. So, school once again. So, talking with teachers. Share information on CF with the school. You can tell them as much or as little as you need to. But if you want them on board, they need help to understand what you're asking. So, who you tell, how much, and how we tell. I had a mum ring up one day and she said to me, school teacher, I've been on the school and I demanded that she did this and this and this and this, and I just heard the word demand. I thought, right, okay, take a deep breath. And so we had a bit of a chat, and then I sort of said to her, and I said, do you think how you ask is important? Oh yes, but, and I thought, oops, here we go, the but word. Anyhow, after some discussion, I said to her, it'd be really good if we went back and had a really good chat with the teacher. And I said, if you're struggling, CFWA are really good at doing exactly that. And that's a genius at that sort of stuff. So there we are. And pleased to say that I haven't heard any more, and the child is now back to school beautifully. So, really important stuff, simple but important. Simple stuff again, hand washing. Tony spoke about that at nauseam at length, and it's so important. It should be part of the school policy to teach kids to wash their hands, and it's really important that our kids, your kids, learn very early to do that. It's good for the whole school. Teachers are always complaining they get bugs from kids. Well, hello, you can set a really good example, teacher. It's really good if you can speak with the school about kids staying home with obvious colds. And I know in a working environment, when I first started with CF, all mums with CF kids stayed home. Now you're all back in the workforce. So it is quite difficult, and pupil-free days and holidays and all this sort of stuff doesn't go well with people that are earning a living. It's difficult. However, it should be school policy, and really and truly, it's not rocket science. I had the pleasure of listening to a mum speak the other day in clinic. I was down in Respiratory Med, and she was talking to her child about staying away from people. The language she used, and I should have gone and written it down. It was just magnificent. It was about the language. It was no blame. It was no derogatory statements. It was just awesome. As I said, silly me, I didn't write it down because the words were really impressive, and I went and said to her, how impressed I was. It's a really good thing to do, but to do it well is exceptionally good. Right, we are getting more kids attending schools with CF, and this is where a bit of focus and balance comes in. If possible, separate classes. If not possible, widely spreading within a classroom. And how far is widely spread? Well, how long is a piece of string? And Tony spoke about that. We don't know. That's an ever-changing point of interest. Point out other kids that have got CF. Encourage your kids you know, if they can choose other people to play with, that's a really easy way to avoid things. Invariably, some kids will, you know, pick out each other, and then, you know, it's a bit of a problem. But, you know, once again, I think it's the way you do it and the language that you use, and particularly if it's not inflammatory language, because a kid will immediately say, well, I'm going to do it anyway. We all know that. That's interesting. I had a little kid in the department yesterday, and I think the only words I heard from the child, and it was, you know, you would have guessed it was a 2 to 3 year old, was no, 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 no. And I thought, I know how old you are. Yeah, interesting. I thought, poor mum, she looked exhausted. I said, go to the fish tank for a while. Do whatever you need to do. Go shout or whatever. Okay, kinder and preschool, this is where we start. Ensure you teach other on board, work with them. They need to understand why these kids take enzymes and seek their assistance with it. As I said, it's once again about the language. But the best thing you guys can do for yourselves and for your kids is get rid of that gungy apple puree. Get rid of it. Somebody rang me up the other day and said that they've got the kid swallowing tablets, and I went, yes, yeah, go girl. And you know, it's just, it frees you up. Life's so good. But when you're at school, teachers, their first job is to teach your kids. They are not nurses, they are not doctors, they're not mums, they often are, but they're not your child's mum. So allow them to do their job while you're doing the job at home. Work with them is the bottom line. Exercise. Oh, do it regularly. Yes. I work with dogs. But it's really good for kids with CF. We all know that, and you've all heard that. Important to compete within in their own level and at their own level. If you're unsure of what they could and are capable of and should be doing, your physios will work with you on that and give you an estimation. And there's ways of curtailing sport if they need to and when they need to. But it's really makes you good. The endorphins get loose and you feel really, really good. And particularly aerobic stuff that's really good for kids with CF. I had a mum ring me a few years ago actually, and she said, oh, my kid won't do sport. It was a boy. And she said, oh, he won't do anything, you know, he's busy with the Yep. And she said, he's actually expressing an interest in singing. What do you think? And I said, yes! Where do you sing from? If you're learning to sing properly, it's a diaphragm. How good is that? I said, you'll do it. She went, oh, yeah. So, her boy sang, and he sang quite beautifully, actually. He was very talented. So it was good for his self-esteem and good for, you know, he was exercising. He didn't even know it. I love it. So, you all know this, it's important that they get extra salt, but it's also important that they drink more. They're having more salt, and kids with CF are not quite sure when they're thirsty at times, so it's up to us to encourage them to drink. And Tony's already spoken about the water bottle, so that's really good. But if your kids don't want to take tablets and salt tablets and things like that, just get some Gatorade and pop them in at the beginning of the day. They go to school with a bottle of Gatorade and nobody knows the difference, do they? Unless they swap bottles and then they'll go, ooh! Sorry. Salt solution for younger kids, tastes ghastly. I don't know how you get it into your kids. You do a marvellous job, you lot. But exercise must be fun. Like I said, pick what they like, pick what they can do, and do it well. Oh, I asked Tony to send me his talk because I thought, oh my God, what am I going to say about this? And we need to sing off the same page. He sent me back an email to say that he was doing his talk last night. So I thought, oh, right, thanks, terrific. Anyhow, I think, oh, he's up there. Tony, I think we got it right. Well
no, great minds think alike.
It's great when we sing off the same page. Yeah, so there we are. We won't go through that again. Okie dokie, so yeah, we've talked about that. Minimisation is the key, and I think, you know, I just love the way you pitched it, Tony. It was awesome as far as I'm concerned. I hope you guys enjoyed it too. Okay, as I said, I know infection control is incredibly important to you, and it is to us. We take it very seriously. Everything that we do is evidence-based. Our infection control manual is under review as we speak, and as Tony said, the US Foundation are upping the ante at the moment, so we will reflect that as that comes available. And infection control includes the kids on our HIS program. So hospital and home should be, those sorts of precautions shouldn't be any different from what's happening in the hospital to what's happening with your kids at home. And that will be something that you'll probably see ramping up soon. So in patients, it's simple but it works. Hand washing is wonderful stuff, and yes, there's pump packs all over the place. Kids will be isolated, kids with CF, and wherever possible, put them in single rooms. And that is managed on a hospital basis. And these rooms are cleaned according to the gospel, according to Tony and his department, so we would never argue or try and change any of that. They're the experts, not us. Okay, outpatient areas, yes. Use your pager system, we've got that there. Our pages are absolutely wiped every time they come back with the appropriate wipes. And if you forget to hand them in, can you pop them in a bag and send them to us? That would be really good, because it costs $100 each, and we've lost a couple of them recently. So that's really, would be really appreciated. Get your kids to wash their hands frequently when they're outpatients. Make good use of the alternate waiting rooms. If you have to keep the doctors waiting, but you can hear this, Andre. Sorry, they'll just have to wait for you to come back from these areas, because it is important. And services are wiped clean frequently, particularly the physio rooms. The physio girls are awesome at that. CF Australia, I don't know whether you probably are, because you're astute parents, that's why you're here today. They've got an infection control policy which is very much aligned to best practice in Australian CF centres, and it's available on the website. So, the gospel according to Liz. The disease hasn't changed, just the treatment has improved and treatment's become more intense. So, it's important you keep going and doing what you're doing and doing very well. And the simple things are what make a difference. Cleaning your nebulizers, cleaning your hands, doing physio, etc. Those grueling maintenance things are the things that actually make a huge difference for your kids. You could argue quality of life, but there's ways to, it becomes the norm for kids with CF. And it's part of becoming a child stroke person with cystic fibrosis. So, make it as much fun as you can, intersperse it, be innovative, time-wise and things like that. As I said, miss the occasional physio for a sleepover. It's important. And you can hear me saying that. Okay, I found this on Ali's desk, and she hadn't even seen it. This comes from an American publication, but I reckon it just encapsulates it beautifully. Can you read that? Yeah. Yep. I'll give you a sec to read through it. And God forbid we've got any smokers, but bless their hearts, if they come and see us, we'll help them with it. So even your rallies, if they're smoking. And I know there are some people who do smoke. When you work in respiratory medicine, you've got a twitchy nose. Here's a head coughs and twitchy noses that smell smoke, so, yeah. But there are ways of doing this and doing it as easily as giving up something as hideously as Judas smokes. We're certainly happy to help people with that. Here ended the lesson. So I probably haven't taught you anything, but I hope I've shared some things that may help you, whatever. I'm not sure. Thanks for listening.
have the same cleaner go from room to room cleaning.
Mm-hmm.
They don't always change the cloths that they're changed by cleaning all your bedposts and your things. And they don't change them off. How does that not carry in different bars from one room to another?
Oh my God, that's a micro. Well, first of all, I would ask them to change their cloth. That's fine, that's not a problem. The same as you can ask any of us that are walking into your room to wash our hands and clean our hands, and that includes doctors. You know, you're very much at liberty to do that. As far as the mops go, look, our infection control team do look after it and look into all those things, and I'm not sure of the answer to that. Yeah, but you know, I take your point. I
That
guess,
really disturbs me because you're in hospital because you're sick and you know that the person next to you might have cepacia,
yeah,
which you really don't want.
no.
And they go to them first and then to us and you're like, oh, hi, you're using the same mop. And also the fact, using chemicals, I don't know if they use bleach or something.
So what was that?
They might use bleach, is it? To do mopping?
Sometimes it smells like it. My God, even
And I
I
can't
inhale it.
breathe and I'm coughing and I'm like,
Yeah,
how's this work? And then you're cleaning my room, but
yeah, they
I
are.
can't breathe.
Some of them are irritant, you know, to even my lungs. Mine aren't unhealthy, but they're old.
But is there a way around that one?
I don't know.
It's not like
Tony, Andre?
Yeah, no, look, this is really good, a really good question. I also chair the PMH Infection Control Committee, amongst my other things, and one of the difficulties, I mean, it's not an excuse, it's just an acknowledgement of the scenarios in the real world of one can sort of implement and devise appropriate policies, but the devil is really in the actual, how they get rolled out and used, you know, in a sense, at the floor level. So I'll have to sort of go back and speak with my infection control team members as to what our sort of policy is about, you know, MOPs in sort of disparate patient areas and the potential for transmission, and our MOP decontamination methods to sort of try and address that.
Good.
So, but it's good to, I'm not at all surprised, sadly, that sort of stuff does occur. Having said that though, the difficulties in any sort of public healthcare system is staffing levels and the workloads that cleaners, etc., are faced with, and trying to accommodate high and appropriate standards of infection control is particularly difficult when in fact the cleaning staff are under significant pressures.
It's also funny that the cleaning staff aren't allowed to touch the sputum cups.
Yeah.
So they leave them,
Yeah.
and then a new patient,
Yeah.
I went into a
Yeah.
freshly made room,
Yeah.
and there was sputum cups there.
Yeah.
And they're like, oh, I've already done a sputum sample. I'm like, no?
Yeah.
It's like,
Yeah, no, look, it's, I mean, tertiary hospital environments are always difficult. Staff at all levels are under, you know, a fair amount of, you know, work stress and demands. And seemingly with entreaties to the higher ups for, you know, additional personnel to meet sort of the workload falling on deaf ears. So,
and my second one was, just out of curiosity, I don't know who will know, direct this on to is, I lived in Melbourne for 18 months, and I shared a room with the CFO, and that's common practice. How is it different in WA?
well, we try to absolutely minimise that. In fact, we try and not have that situation occur at all. Obviously, if patients being sort of co-housed with another severe patient.
I thought it was quite fascinating. So I was like, oh,
Yeah.
they were doing physio and nebs and
Yeah.
everything in the same room.
Look, and I think that is interesting. Undoubtedly, there is sound and strong molecular evidence to support cross-infection in some of the eastern states, you know, CF sort of, you know, areas. On the contrary, the evidence doesn't seem to be there for, you know, Western Australian type isolates overall, and the limited sort of work that's being done on them. And that's probably because of policy of trying to sort of keep CF patients separated. So we certainly strive to do that. It can be difficult in terms of the number of rooms that we have and the utilisation and where we're at with the seasons. With the new Children's Hospital, when that comes online, the proportion of single rooms is going to be really quite substantial, at least 80% plus. So that will further minimise the risk of any sort of, any sort of cross-transmission from another patient, because effectively everybody's going to be in a single room.
Have you seen the new hospital? I came past there today and I thought, oh, because I've only seen virtuals of it, and I thought, oh my God, it's really happening.
Does anyone know what's happening to the LP Road?
I guess a bulldozer. Well, it's very valuable land, and it's very landlocked, so I mean, I'm guessing that. I don't think anyone's talked beyond the new hospital, let alone the old hospital. Yes?
I don't know if this is a question for you or for Andre or Tony, but I always get concerned in the little lung function rooms about, going one after the other, the kids doing lung function, and, often when they do the lung function it makes them cough, and, we've often gone into lung function and, the technician will sort of wipe down the machine, but, frequently I sort of watch my child climb onto the back of the seat and the hands on the glass, and then sort of, all that sort of stuff, and I just wonder how that, if that's sort of a risk that's thought about or being.
Yeah, that's a good question. We do practice adhere to international standards for keeping all the lung function equipment clean, and that includes the vital filters, etc. And yes, of course, kids can cough in between. And I think to answer that, and also the mob question, one has to be pragmatic eventually and stand back and look. The mob problem's probably been going on for many years, and they've been using that same box for many years, and we haven't shown any clonal strains being transmitted from one patient to the next. So it's definitely not that we picked up that that the lung function lab is a centre for spreading bacteria. It's something to think about, but I'm not sure there's evidence to suggest that we should change what we do, or any practical way that we can change what we do.
I guess the other point to note is that whilst the walls and stuff might be heavily contaminated by sputa, laden with all manner of pathogens, it's not like they're going to sort of leap off the walls. So if in fact you go in and you come out and then you practice, say your kid practices appropriate hand hygiene, then anything that they have touched that hasn't been sort of wiped down and decontaminated and that they've picked up on their hands will effectively be removed by hand hygiene. So I think that's a sort of a very simple strategy that you sort of do, as Andre has indicated. The overall management of the respiratory function equipment, is at best practice standards. But if you wanted to do a little bit more to minimise the potential of your child having picked up stuff on their hands and stuff, then simple hand hygiene, I won't say yes, it would be a reasonable thing to do.
Yes.
Tia doesn't do the lung function yet because obviously she's too young. But when you guys schedule that, do you actually spread the CF kits? Is there any kind of way that you guys do that? Do you only have a couple of CF kits in a day, or I'm not sure how it's done because we haven't.
Yeah. Well, I mean, there are consecutive kits that come with CF.
Yeah.
They all wash their hands when they go in there, as you probably know. Tia's doing hot yet, but anyhow.
Yeah.
And as Tony said, you could wash them on the way out, But I mean, we've just had infection control people down to the lab. We're watching all the time,
Yeah.
and we try it. The world's not a perfect place. We work within really good guidelines, and we are onto it all the time. And I mean, we have frequent visits from our infection control people there who watch and things like that. So yeah.
I suppose the very sketchy is kids with just asthma and just
Yep,
restriction. That's
yep.
what I'm saying. When you schedule the CF kids, do you have some kind of your space? You're not having them straight after each other. You try to.
It all depends. It all depends. You'll see but part of the reason I stay downstairs and Ali's upstairs running the clinics is that we control who's in and around the, the lab area and the waiting area. And, you know, we do that very surreptitiously. In fact, our secretarial staff are onto it now. I got a Liz the other day, which is really great. I mean, you know, it's people are extremely aware of it and working very hard to work with you to keep the kids well.
Yeah, I do appreciate when we come in and say, yes, go to there, or don't go there. Like, yeah.
Traffic cop extraordinaire.
Got door handles and everything else like that, but it's, like you said, if you're hand washing,
Yeah.
doing the best you can.
And
It's easier as your children get older and they understand.
That's right, and it's Alco White. You know, near the fish tank says Alco White. You know, you're going past there. Yeah. So, I mean, it's interesting. Do you mind if I say it? Okay. Kate came back from the recent conference, and she was saying that there was a. You tell me, Kate. I think this is really powerful.
We're just talking about managing CF, and there was one mother who gave a presentation at the conference about managing CF, and she was quite self-deprecating, wasn't quite sure why she was picked, but she obviously had two older boys who were in their 20s with CF who were all off to Camp America and doing economics in uni, and she was fielding some questions, and in response to one question, she said, look, I think the thing that I don't know, I'm just quoting her words, I'm quoting Mrs. Gospel, the thing that I've taken through this is that, you know, at the end of the day, CF is your child's disease, not yours, and like anything as a parent, like you teach them to, you know, brush their teeth and tie their shoelaces and make the right decisions so that eventually you become redundant as a parent, you also have to teach them how to be responsible for their own disease. And she was just giving examples about how it's important that when you release them into the wide world that they know what to do and how to manage, you know, their own illness, and you're not always going to be there. And she was giving examples of tips, like she always encouraged her children from a very young age to make sure they had a question to ask the doctor at clinics, because even, you know, quite a young age, even from teenagers, if they don't want the parents to come in with them, they have to be able to talk with their doctor about, you know, things that are bothering them and all that sort of stuff. So she was just talking about the fact that ultimately it's about teaching your child to be responsible for their disease, and you're not going to be able to carry it for them for their whole lives. So it was just, I was just talking to Liz and she thought that was...
I thought it was really empowering. Just, yeah.
I think because we all carry some guilt about the fact that we passed it on, that we feel that we have to be part of it, but they are going to have to take it on themselves.
Your job as a parent is to become redundant. That's when we've parented at our best, and I'm still struggling with that, I can tell you. Sam?
Just to add on to what Kate was saying, yeah, it's good for them to ask questions to the doctor from a young age, but it's also good for them to ask, as much as people hate me saying this, why? So then they can understand that, yes, there are pros and cons to what you're doing. May it be physio, may it be medications, may it be schools, anything to do with your health. Why? So then you can understand why you're doing it, not just being told to do it.
When it makes sense at work, it usually works,
And that way the doctor can also learn to speak to your child as a human, not to the mother or the father, and forget that they're in the room.
Cool.
Any more questions? Okay, look, thank you so much. Thank you everyone from PMH, and thank you Andre for organising it as well. We've got a light lunch. You're welcome to stay for some lunch, and I'm not sure if you're available for individual questions or...
So I'll be around, and so I'll be around for questions. And I was going to say, I'm going to organise it, Catherine will organise it.
and feedback forms, please, everyone. Just a couple of minutes. Excellent. Well done.